Hi, and welcome to Family Services Educational Expedition. This is Cheryl DePaolo. I am the Program Director of the Ulster Prevention Council, which is a prevention program of family services. We're going to be talking today about opiates. Hi, welcome to another part of the series. Hi, welcome to the Family Services Educational Expedition. I am Cheryl DePaolo, Program Director of the Ulster Prevention Council. The Ulster Prevention Council is a prevention program of family services, and we are located in Ulster County, New York. We're going to be talking today about opiates, and I would encourage you, if you have not already, to go back and listen to the webinar that I recorded about substance use disorders in order to understand this training a little bit better, especially in regards to reducing the stigma related to opiate use disorders, proper terminology that's non-stigmatizing, and so forth before you listen to this webinar. I just wanted to pull up this list of people who are known to have used opiates, and can just take a look and see if there are names that you recognize there. Some of whom you may say, oh yeah, I know that person used opiates, but some that may be a surprise to you. And we'll see just how common this can be and how it can affect anybody in any walk of life. In the United States, a drug scheduling guide we're going to mention today, Schedule 1 includes heroin and other drugs that have no potential for medical use that's safe. Schedule 2, high potential for abuse, but has medicinal qualities. And Schedule 3, moderate potential for abuse and acceptable medicinal qualities and so forth. So we'll be referring back to that. So when we talk about opiates and opioids, we're talking also about narcotics. And narcotics, opiates, and opioids are all in a similar vein. The word narcotic comes from the Greek word for stupor and originally referred to a variety of substances that dulled the senses and relieve pain. Some people still refer to all drugs as narcotics, but today narcotic refers to opium, opium derivatives, and their semi-synthetic substitutes. A more current term for these drugs with less uncertainty regarding its meaning is opioid. Examples include heroin and pharmaceutical drugs like OxyContin, Vicodin, codeine, morphine, methadone, and fentanyl, and we'll be talking about all of those. What is their origin? The poppy, Papaver somniferum, is the source for all natural opioids, whereas synthetic opioids are made entirely in a lab and include meperidine, fentanyl, and methadone. Semi-synthetic opioids are synthesized from naturally occurring opium products such as morphine and codeine, and they include heroin, oxycodone, hydrocodone, and hydromorphone. Opioids and opiates can be obtained from friends, family members, medicine cabinets, pharmacies, nursing homes, hospitals, hospices, doctors, street dealers, and the internet. Opioids come in a variety of forms, which we'll see, including tablets, capsules, skin patches, powders, chunks in various colors from white to shades of brown and black, liquid for oral use and injections, syrups, suppositories, and even lollipops. Narcotics or opioids can be swallowed, smoked, sniffed, or injected. Besides their medical use, opioids produce a general sense of well-being by reducing tension, anxiety, and aggression. These effects are helpful in a therapeutic setting, but they contribute to the drug's abuse. Opioid use comes with a variety of unwanted effects, including drowsiness, inability to concentrate, and apathy. Use can create psychological dependence. Long after the physical need for the drug has passed, the user may continue to think and talk about using drugs and feel overwhelmed coping with daily activities. Relapse is common if there are not changes to the physical environment or the behavioral motivators that prompted the use in the first place. Opioids can be prescribed by doctors to treat pain, suppress cough, cure diarrhea, and put people to sleep. The effects depend heavily on the dose, how it's taken, and previous exposure to the drug. Negative side effects can include slowed physical activity, constriction of the pupils, flushing of the face and neck, constipation, nausea, vomiting, and slowed breathing. And as the dose is increased, both the pain relief and the harmful effects become more pronounced. Some of these preparations are so potent that a single dose can be lethal to an inexperienced user. However, except in cases of extreme intoxication, there's not usually a loss of motor coordination or slurred speech. Physical dependence is a consequence of chronic opioid use, and withdrawal takes place when drug use is discontinued. This physical dependence doesn't really take long. It can take a matter of days to weeks to develop a physical dependence on opioids. The intensity and character of the physical symptoms experienced during withdrawal are directly related to the particular drug used, the total daily dose, the time between doses, the duration of use, and the general health and personality of the user. These symptoms usually appear shortly before the time of the next scheduled dose. Early withdrawal symptoms often include watery eyes, runny nose, yawning, and sweating. And as withdrawal worsens, symptoms can include restlessness, irritability, loss of appetite, nausea, tremors, drug craving, severe depression, vomiting, increased heart rate and blood pressure, and chills alternating with flushing and excessive sweating. However, without intervention, withdrawal usually runs its course, and most physical symptoms disappear within days or weeks depending on the particular drug. Overdoses of opiates are not uncommon and can be fatal. And physical signs of narcotic and opioid overdose include those constricted or what we call pinpoint pupils, cold, clammy skin, confusion, convulsions, extreme drowsiness, and slowed breathing. Other drugs that cause similar effects, with the exception of pain relief and cough suppression, most central nervous system depressants, like barbiturates, benzodiazepines, and alcohol, have similar effects, including slowing your breathing, tolerance, and dependence. So the first particular drug that we're going to talk about is opium. And I looked for a picture of opium use online and found that most of the pictures were quite either antiquated or racist, picturing, people lying down smoking in opium dens and so forth. This picture is actually from a museum with a couple of opium pipes, and opium is still used. It's a highly addictive, non-synthetic narcotic that is extracted from the poppy plant. The opium poppy is the key source for many narcotics, including morphine, codeine, and heroin. So the poppy plant was grown in the Mediterranean region as early as 5000 BC, and it's been cultivated in a number of countries throughout the world. The milky fluid that seeps from incisions in the unripe seed pod has been scraped by hand and air dried to produce what is known as opium. A more modern method of harvesting for pharmaceutical use is by the industrial poppy straw process of extracting alkaloids from the mature dried plant. It's called concentrated poppy straw. All opium and poppy straw used for pharmaceutical products are imported into the United States from legitimate sources in regulated countries. Some common street names for opium include Auntie, Auntie Emma, Big O, Black Pill, Chandu, Chinese molasses, Chinese tobacco, dopium, dream gun, easing powder, God's medicine. There are many, many different names for this. Opium can be a liquid, solid, or powder, but most poppy straw concentrate is available commercially as a fine brownish powder. Opium can be smoked, intravenously injected, or taken in a pill form. It's also abused in combination with other drugs. For example, black is a combination of marijuana, opium, and methamphetamine, and Buddha is a potent marijuana spiked with opium. The intensity of opium's euphoric effects on the brain depend on the dose and route of administration. So it works quickly when smoked because the opiate chemicals pass into the lungs where they're quickly absorbed and sent to the brain. An opium high is very similar to a heroin high. Users experience a euphoric rush followed by relaxation and the relief of physical pain. Opium, like most opiates, inhibits muscle movement in the bowels, leading to constipation. It can also dry out the mouth and mucous membranes of the nose. And if you've ever been given a prescription for an opiate painkiller, you may have experienced that constipation and/or dry mouth and mucous membranes. Opium use leads to physical and psychological dependence, and it can lead to overdose. The legal status in the United States, opium is a Schedule II drug under the Controlled Substances Act. Most opioids are Schedule 2, 3, 4, 5. Some drugs that are derived from opium, such as heroin, are Schedule I drugs. We're going to talk next about heroin. And we know that heroin is a highly addictive drug, and it's a rapidly acting opioid. Heroin is processed from morphine, which is a naturally occurring substance extracted from the seed of poppy plants grown in Mexico, South America, Southeast Asia, including Thailand, Laos, and Myanmar, and Southwest Asia, Afghanistan, and Pakistan. Heroin comes in several forms, primarily white powder from Mexico and South America, and black tar and brown powder from Mexico. And we hear from our law enforcement partners that most of the heroin in this region and throughout the United States seems to be coming into the country through Mexico at this point. Common street names for heroin include Big H, black tar, Chiva, hell dust, horse, smack, and thunder. Heroin is typically sold as a white or brownish powder or as the black sticky substance known on the streets as black tar heroin. Although pure heroin is becoming more common, most street heroin is cut with other drugs or with substances such as sugar, starch, powdered milk, or quinine. Heroin can be injected, smoked, or sniffed or snorted. High purity heroin is usually snorted or smoked. Because it enters the brain so rapidly, heroin is particularly addictive and both physically and psychologically. Heroines report that surge of euphoria or rush followed by a twilight state of sleep and wakefulness. Its effect on the body, one of the most significant effects is addiction. With regular use, tolerance to the drug develops. Once this happens, the person must use more heroin to achieve the same intensity. As higher doses of the drug are used over time, physical dependence and addiction to the drug develop. Because heroin users do not know the actual strength of the drug or its true contents, they're at a high risk of overdose or death. Effects of overdose from heroin, again, are slow and shallow breathing, blue lips and fingernails, clammy skin, convulsions, coma, and possible death. So heroin is Schedule I, meaning that it has a high potential for abuse, no currently accepted medical use and treatment in the United States, and a lack of accepted safety for use under medical supervision. We're going to talk about opioid painkillers, and opioid painkillers can include many different substances: oxycodone, hydrocodone, Probuphine, meperidine, and codeine, and meds that contain codeine. And one thing that's true of all of these opioid painkillers is that mixing them with other drugs or with alcohol greatly increases the risk of overdosing from these drugs. One thing that's important to note about opioid painkillers is that we know at this point that they are really meant for short-term use by someone with a medical condition, so a surgery, an injury, and should not be used for the long term. And so prescriptions now are generally for 2 weeks or less, maybe 5 days. They used to be much longer. But because of the dangers of addiction, and then we know of people who've gone on from using these painkillers, can't get them, and they move on to stronger opiates or even to street heroin. One of the things that people with substance use disorders will sometimes do is look to the streets to obtain a substance once they are not able to get it from the doctor anymore. And it's important to note that many of these painkillers have copycats out on the street that may look close to or identical to the prescription drug, and yet they're made in clandestine labs, maybe with a pill press stamped with the proper markings, colored with the proper colorings. So someone may think that they're actually being safer by buying, say, OxyContin or Vicodin on the street, and really it may not be that drug quite at all. It may be something, even a different drug. When we look at these opioid drugs, the FDA has approved 18 of them, and they're all compared to the strength of morphine. So morphine is kind of the baseline, and you'll see kind of in the middle between the yellow bars and the red bars that hydrocodone is similar to morphine in strength, and that the yellow bars going upwards are less strong than morphine. Tapentadol, codeine, tramadol, some of these we're familiar with. Tramadol is 10 times less strength than morphine. Codeine, 6 times less strong than morphine, so they can get an idea of how strong these drugs are. And then you'll see that some of the drugs we're going to talk about are much stronger than morphine, including oxycodone, methadone, oxymorphone, hydromorphone, butorphanol, and buprenorphine. And then you'll see at 80 times-ish stronger than morphine, we're going to discuss fentanyl. Morphine is a non-synthetic narcotic, and remember that's what we're going to put a baseline strength at, with a high potential for abuse, and it's derived from opium. It's used for the treatment of pain, and in the United States, a small percentage of the morphine obtained from opium is used directly for pharmaceutical products. The remaining morphine is processed into codeine and other derivatives. Some common street names for morphine include Dreamer, God's Drug, House, Mr. Blue, Morph, Morpho, and Unky. Morphine is marketed under generic and brand name products including MS Contin, Oramorph, Roxanol, Cadian, and RMS. Traditionally, morphine was almost exclusively used by injection, but the variety of pharmaceutical forms that is marketed today support its use by oral or other routes of administration. So forms of morphine include oral solutions, immediate and extended release tablets and capsules, and injectable preparations. Those dependent on morphine prefer injection because the drug enters the bloodstream more quickly. Morphine's effects, again, include euphoria and relief of pain, and chronic use results in tolerance and physical and psychological dependence. It also can result in decrease in hunger and inhibition of the cough reflex. And morphine is a Schedule II narcotic. Oxycodone is a semi-synthetic narcotic analgesic, and historically it's been a popular drug of abuse among the narcotic abusing population. Oxycodone is synthesized from thebaine, which is a constituent of the poppy plant, and its common street names are hillbilly heroin, Kicker, Ox, Roxy, Perk, and Oxy. Oxycodone is marketed alone as OxyContin, and other immediate release capsules like Oxy LR. It's also marketed in combination products with aspirin, such as Percodan, or acetaminophen, such as Roxyset. It's abused orally or intravenously. The tablets can be crushed and sniffed, or dissolved in water and injected. Others heat a tablet that's been placed on a piece of foil and then inhale the vapors. Again, euphoria and feelings of relaxation are the most common effects, which explain its high potential for abuse. And we see the same symptoms of physiological effects and overdose effects, and it's a Schedule II drug. Hydromorphone is Dilaudid or Exalgo, and it has an analgesic potency of 2 to 8 times greater than that of morphine, and it has a rapid onset of action. Hydromorphone is legally manufactured and distributed in the United States. However, users can obtain hydromorphone from forged prescriptions, doctor shopping, theft from pharmacies, and from friends and acquaintances, as well as on the street. Street names include dillies, dust, footballs for the shape of the pills, juice, and smack. It comes in tablets, capsules, oral solutions, and injectable formulations. Users can abuse the tablets by ingesting them. Injectable solutions, as well as tablets that have been crushed and dissolved in a solution, can be injected as a substitute for heroin. And when used as a drug of abuse and not under a doctor's supervision, it's taken to produce feelings of euphoria, sedation, and reduced anxiety. It may also cause mental clouding, changes in mood, nervousness, and restlessness, and it works centrally in the brain to reduce pain and suppress cough. Hydromorphone use is associated, again, with both physiological and psychological dependence. It can cause constipation, that pupillary constriction, retention of urine, nausea, vomiting, respiratory depression, impaired coordination, loss of appetite, and changes in blood pressure. Acute overdose can produce severe respiratory depression, drowsiness progressing to stupor or coma, lack of skeletal muscle tone, cold and clammy skin, reduction in blood pressure and heart rate. And overdose deaths, again, result mostly due to respiratory depression. It's a Schedule II drug with an accepted medical use as a pain reliever, but with a high potential for abuse, and use may lead to severe psychological or physical dependence. You've probably heard of fentanyl, and fentanyl is connected to many of the overdoses that we are currently seeing in this country. And fentanyl is a potent synthetic opioid drug approved by the FDA for use in pain relief and anesthetic. However, it is approximately 100 times more potent than morphine and 50 times more potent than heroin as an analgesic. So fentanyl was first developed in 1959 as an intravenous anesthetic. It's legally manufactured and distributed in the States, and licit fentanyl pharmaceutical products are diverted by theft, fraudulent prescriptions, and illicit distribution by patients, physicians, and pharmacists. And again, on the street, it can be the real deal, or it could possibly be fake fentanyl or manufactured in a clandestine lab. From 2011 through 2018, fatal overdoses associated with abuse of clandestinely produced fentanyl and fentanyl analogs and law enforcement encounters increased markedly. According to the CDC, in 2011 and 2012, fentanyl was involved in about 2,600 drug overdose deaths for each of those years, but that rose dramatically year after year. And there has been a re-emergence of trafficking, distribution, and abuse of illicitly produced fentanyl and fentanyl analogs. And so in 2018, we had 31,000 overdose deaths. Common names for fentanyl. You'll see Apache, China Girl, Chinatown, Dance Fever, Friend, Goodfellas, Great Bear, He-Man, Jackpot, King Ivory, Murder 8, and Tango and Cash. What does it look like? Well, there are many, many different forms of fentanyl. And fentanyl is really made, the reason why we have this very, very strong drug, it's really made for end-of-life, pain relief. And so it's available in forms that make it easy for the patient to take who may have difficulty with other types of pills and drugs. So pharmaceutical products currently available, oral transmucosal lozenges that are commonly referred to as fentanyl lollipops. That drug is Actique. Effervescent buccal tabs, or also known as Fentora. Sublingual tablets, Abstral. Sublingual sprays, known as Subsys. Nasal sprays, Lizanda. Transdermal patches, known as Duragesic, and ejectable formulations. Clandestinely produced fentanyl is encountered either as a powder or in counterfeit tablets, and it's sold alone or in combination with other drugs such as heroin and cocaine. Fentanyl can be injected, snorted, sniffed, smoked, taken orally by pill or tablet, and even spiked onto blotter paper like LSD. Fentanyl patches are abused by removing the gel contents and ingesting or injecting the contents. Patches have also been frozen, cut into pieces, and placed under the tongue or in the cheek cavity. Illicitly produced fentanyl is sold alone or in combination with heroin and other substances and has been identified in counterfeit pills, mimicking pharmaceutical drugs such as oxycodone on the street. Fentanyl is similar to other commonly used opioid analgesics in producing relaxation, euphoria, pain relief, sedation, confusion, drowsiness. Overdose may result in stupor, changes in pupillary size, cold and clammy skin again, cyanosis, coma, respiratory failure leading to death. The presence of a triad of symptoms such as coma, pinpoint pupils, and respiratory depression are strongly suggestive of opioid poisoning. And fentanyl is a Schedule II narcotic. Just want to take a look for a minute at overdose death rates involving opioids, and you'll see here how heroin overdoses have risen, but also the other types of opiates that we're talking about, and fentanyl is definitely involved here. You'll see in 2018 there's a little tick downward, and so we're hoping that this overdose rate may finally be started on a downward trend. We're very hopeful that that may be the case. I want to talk to you about one other drug that's involved in these overdose deaths, unfortunately, and that is carfentanil. And carfentanil is an animal tranquilizer. It's used, if you look at the picture here, we're looking at an elephant surgery, and you can see the size of the men next to the size of this elephant that this drug has been used to sedate, and you can imagine that it does not take a lot of carfentanil to overdose. It takes a very small amount, as carfentanil is 10,000 times stronger than morphine, 100 times stronger than fentanyl. So here's another kind of way to look at that: a lethal dose of heroin versus a lethal dose of fentanyl and a lethal dose of carfentanil. And in the case of carfentanil, you can see that it's a very, very small amount, just about a grain of salt. And one of the reasons that these overdoses happen is that when substances are being mixed in with heroin or other drugs in order to cut them, they can be pretty sloppily mixed, The manufacturers are not particularly scrupulous about how well they may cut their drugs, and so even one tiny bag of heroin could have some hot spots in it that have greater amounts of fentanyl or carfentanil than other spots in the same little bag of heroin, even so that someone could use and survive it and take another dose from the same bag at a different time and overdose and die because they found a place that with more concentrated fentanyl, carfentanil, or other strong substance. And so this is an extremely dangerous situation. So again, we find people kind of looking to get, what they consider to be legal drugs on the street because they're afraid at this point of fentanyl or carfentanil. The other thing to realize too, though, is that for someone who's addicted to opioids, death may not be their biggest worry. They may be more concerned about avoiding that withdrawal. Their life may have become misery, and so sometimes what we would see as a risk that nobody would take actually becomes a risk that they are willing to take. I want to talk to you about a couple of other substances that we've seen on the streets. And if you listen to my webinar on designer drugs, I'm going to just talk about one or two drugs that I talked about in that presentation. And the first one is pink, or U47700, commonly known as pink, pinky, or U4. And this was created in a lab by the 20th century pharmaceutical giant Upjohn. It is 7.5 times more potent than morphine. So this is a drug that was intended to treat severe pain associated with cancer, surgery, or injury, but it was never tested on humans, and it ended up being relegated to research. About 80 deaths have been identified, including the overdose death of Prince, which was caused by a cocktail that included both fentanyl and U47700, or pink. And the envelope that you will see on the left-hand side is a screen grab. I just kind of Googled where can I buy pink, and you can order this online and get it delivered right to your home from a clandestine lab. And this is an example of that. It has kind of a batch date on it, and the email, which is, I'm sure, changed kind of often, but this is how easy it is to get online. Even small doses can be very toxic or even deadly, and importation to the U.S. is primarily from clandestine chemical labs in China. It's been seized by law enforcement officials on the street in powder form and as tablets, and typically it appears as white or light pinkish chalky powder. It can be sold in glassine bags stamped with logos imitating heroin, in envelopes and inside knotted corners of plastic bags, which is similar to the way that heroin is sold. Labels on products might say not for human consumption or for research purposes only. This is pretty typical of those selling designer drugs in an effort to avoid legal detection or to print a disclaimer. And it's been identified and sold on the internet misleadingly as a research chemical at about $30 a gram. So fatalities due to pink in the U.S. join the growing incidence of drug overdose deaths due to prescription opioids and synthetic designer drugs like spice and bath salts. The public using these street or internet products can never really know exactly what's in them, how much, or the degree of toxicity with use. The DEA reported at least 46 deaths linked to pink in 2015 and 16, and no deaths prior to that. It can be found in combination, knowingly or unknowingly, with other drugs of abuse bought in the streets, such as heroin or fentanyl, and it has also been confiscated as a separate product. So the patent and chemical details are still available, even though it was never commercially made by Upjohn. It has a chemical profile similar to morphine, but it's reported to be far more more potent. And in 2018, the DEA issued a final order to place pink, as well as its related isomers, esters, ethers, and salts, into Schedule I of the Controlled Substances Act due to an imminent hazard to public health and safety. Currently, this is not included in standard drug screens in the U.S., so it can be difficult to detect. I'm going to talk about a second drug that I also covered in that designer drug webinar called gray death or gravel. And gray death appears similar to concrete mixing powder, and it varies in texture, ranging from a chunky rock-like material to a fine powder. This is not a single drug, but it's considered to be a compound containing several potent opioids. It has a potency much higher than that of heroin and can be administered via ingestion, snorting, and smoking. And an analysis of gray death samples collected so far revealed the presence of pink, heroin, fentanyl, and carfentanil, though the amount of each drug within gray death varied from sample to sample. So one of the most frightening things about this is that the formulation differs from one batch to the next. People testing and studying the samples of this new drug are often mystified by its contents and appearance, and even struggle to explain the substance's signature gray color. When we talked about over-the-counter drugs, I talked about lean or purple drank, but I want to talk about this again because it does include an opiate. And lean or purple drank is also known as Scizerp, dirty Sprite, or lean drink. And this is a combination of a prescription cough syrup that contains an opiate, codeine, soda, and sometimes hard candy. And purple drank is created by mixing large doses of prescription cough syrup. So it's most commonly a promethazine and codeine combined product, which is classically a deep purple color, with a carbonated soft drink and hard candy to improve its flavor. Today, cough medicines with codeine are classified as Schedule V drugs, making them legal only with a prescription. But the potential for misuse was brought into the spotlight with the emergence of dangerous drug cocktails like purple drank in the 1990s. The primary drug ingredient is codeine, whereas promethazine, which is another drug in the cocktail, is an antihistamine. Common side effects: it's known to cause euphoria, nausea, dizziness, impaired vision, memory loss, hallucinations, and seizures. The potential killer cough syrup is cut sometimes with alcohol, making it even more dangerous, and it's typically served in a styrofoam cup. People typically sip purple drink over ice because it does taste pretty bad, warm at room temperature, so lots of ice, lots of soda, some candy to sweeten it up. But it's sipped to experience the reported euphoria and also dissociation from one's body. It's often called a swooning euphoria. The promethazine acts as a sedative, and the codeine creates the feeling of euphoria, and the effect lasts between 3 to 6 hours. Purple drink also goes by the name lean because, similar to being very drunk, people often literally have to lean on something to stand up once the effect takes place. It became popular partly due to the glamorization of Scizerp and its euphoric effects among many celebrities and in numerous hip-hop songs and videos. Purple drank has been responsible for the hospitalization and death of many people, including several celebrities, singers, rappers, and professional athletes. For example, the singer and rapper Mac Miller, who later died of a drug overdose, has spoken about his own addiction to purple drank. Also, Lil Wayne wrote a song about it where he talks about being in the studio, sipping his drink, wishing he could stop, having lost friends to the drug, but he feels that he can't stop. In 2014, the pharmaceutical company Actavis decided to stop producing and selling its prescription-only promethazine codeine syrup product, nicknamed Prometh, due to the rise in recreational use. Unfortunately, that didn't deter its use. In fact, people have reportedly stockpiled the cough syrup, and it remains to be seen whether people seeking a similar high we'll come up with another way to concoct a cocktail replete with promethazine and opioids. Because there's really no way to know the soda to syrup ratio in any given serving, overdose risk is high with drug cocktails like Purple Drank. Each ingredient is associated with various side effects. When used as prescribed, the promethazine acts as an antihistamine, antiemetic for anti-vomiting, and a sedative. Alone, it doesn't usually cause euphoria unless it's mixed with other depressants like codeine and alcohol, as in mixtures like Purple Drank. Codeine is a drug that's metabolized by the body into morphine, and in prescription cough syrup, it works to suppress a cough. Morphine and other opioids can also cause feelings of elation, analgesia, and euphoria, as well as the dangerous side effects that we know are included: coma, hypotension, respiratory depression, sleepiness, stupor, and even sudden death. A number of commercial products have emerged that are inspired by Purple Drank and include herbal ingredients such as melatonin, rose hips, and valerian. These products are often marketed as relaxation aids and sometimes use similar sounding names such as lean or purple stuff. Such products have been criticized for serving as a potential gateway to illicit drug use. If someone develops a tolerance to Zazurp and then suddenly stops taking it, they may experience symptoms of withdrawal. Withdrawal can be very uncomfortable, but it's not life-threatening. Complications can occur that pose a danger, such as vomiting and diarrhea can cause dehydration, as well as chemical and mineral disturbances in the body. We're going to now talk about medication-assisted treatment. And even if you're familiar with the opiate drugs, you may not be as familiar with the medications that are now used to assist in their treatment. And we want to look at medication-assisted treatment as an adjunct to other treatments, such as chemical dependency, traditional treatment, behavioral health, and whole person health, and look at some of the products that are used to assist in treating opiate use disorders, because they cause very severe and permanent changes to the brain. They're more difficult to stop and abstain from without some medication that's helpful. There are other medications that are used, especially for alcohol dependence, but there are specific ones that are used for opioid use disorder. You may be most familiar with methadone because it's been around for a very long time. Methadone is a synthetic or man-made narcotic. German scientists synthesized methadone during World War II because of a shortage of morphine. Methadone was introduced into the United States in 1947 as an analgesic called Buprenorphine. Common street names include Amidone, chocolate chip cookies, fizzies with MDMA, and wafer. One form that it comes in is like a wafer that you put into liquid to drink. Methadone is available as a tablet, an oral solution, or an injectable liquid, and it's available in different formulations. In January of 2008, manufacturers voluntarily agreed to restrict distribution of this methadone to facilities authorized for detoxification and maintenance treatment of opioid addiction in hospitals. It can be swallowed or injected. Abuse of methadone can lead to psychological dependence. When an individual uses methadone, they may experience physical symptoms like sweating, itchy skin, or sleepiness. Individuals who abuse methadone risk becoming tolerant of and physically dependent on the drug. When use is stopped, individuals may experience withdrawal symptoms, including anxiety, muscle tremors, nausea, diarrhea, vomiting, and abdominal cramps. The overdose effects are similar to other opiates. Although it's chemically unlike morphine or heroin, methadone produces many of the same effects. So methadone is a Schedule II drug, and while it may legally be used under a doctor's supervision, its non-medical use is illegal. Currently, methadone is being used for chronic pain and that's kind of a newer medical use for methadone. And it can be used in chronic pain management. It is very important to note that with all of these substances, it can be dangerous. We did have several years ago unintentional overdose of 2 children in Ulster County who got into their father's prescription methadone, which was prescribed for chronic pain, unfortunately. Methadone is a full opioid agonist, which means that it produces similar effects to other opioids. However, because it's longer acting than drugs like heroin, the effects are milder and shouldn't significantly impact the individual's ability to function at the proper dose. Methadone is used to alleviate withdrawal symptoms and drug cravings in those who are experiencing opiate use disorders, whether it be heroin or painkillers. In fact, 1 dose can prevent cravings and withdrawal for up to a day and a half. And in order to prevent abuse, methadone is administered in a clinic on a set schedule. And generally, people, as they are on methadone maintenance, eventually are allowed to take home doses and so forth. And many function quite well on a long-term basis. Despite its relatively mild effects, people taking methadone would still likely experience unpleasant withdrawal symptoms if methadone were to suddenly stop. Some common side effects: dry mouth, headache, sweating, stomach pain, vomiting, sleep disturbances, loss of appetite, mood changes, and reduced sex drive. A newer drug used to treat opiate use disorders is naltrexone, and its brand name is Revial. And it can come in an injectable or pill form, and it's used to treat patients who suffer from an addiction to alcohol or opioids. There's also an injectable version called Vivitrol, and that may be administered intramuscularly, and therefore Vivitrol only requires monthly dosing. Oral dosing occurs once a day. So unlike some other drugs like buprenorphine and methadone, naltrexone lacks potential for diversion and abuse. It works by blocking the opioid receptors. And what that means is that if you take the drug and then take alcohol or opioids, you won't experience the usual euphoria or high associated with the substances. It may also decrease the general urge to use opioids or alcohol, which is very important in medication management. It's important to note that naltrexone decreases your tolerance to opioids, so relapse can potentially be dangerous if someone returns to taking the amount they once did. Overdose and fatal respiratory depression can result. Conversely, there aren't any risks associated with drinking while taking the appropriate amount of naltrexone. When taken in excess, it can lead to severe liver damage, which is why patients should follow their doctor's instructions carefully. There aren't any specific contraindications to using naltrexone concurrently with alcohol, and despite any overt effects to serve as a deterrent to drinking, it will still aid in decreasing drinking behaviors due to the lack of euphoria experienced. While naltrexone blocks the individual from experiencing fully the rewarding effects of alcohol, it does not decrease the other intoxicating effects such as impaired judgment and coordination. Buprenorphine is approved for clinical use in 2002 by the FDA. And medications such as buprenorphine in combination with counseling and behavioral therapies provide a whole patient approach to the treatment of opioid dependency. When taken as prescribed, buprenorphine is safe and effective. Unlike methadone treatment, which must be performed in a highly structured clinic, buprenorphine is the first medication to treat opioid dependency that's permitted to be prescribed or dispensed in physician offices, significantly increasing treatment access. Qualified physicians and mid-level practitioners can offer buprenorphine for opioid dependency in various settings, including an office, community hospital, health department, or correctional facility. As with all medications used in medication-assisted treatment, it should be prescribed as part of a comprehensive treatment plan that includes counseling and other behavioral therapies to provide patients with a whole person approach. Buprenorphine offers several benefits to those with opioid dependency and to others for whom treatment in a methadone clinic is not preferred or is less convenient. The FDA has approved the following buprenorphine products: Bunivail, which is buprenorphine and naloxone buccal film; Suboxone, which is buprenorphine and naloxone film; and Subzolve, which is buprenorphine and naloxone sublingual tablets. Buprenorphine has unique pharmacological properties that help lower the potential for misuse, diminish the effects of physical dependency to opioids, such as withdrawal symptoms and cravings, and increases safety in cases of overdose. It's an opioid partial agonist, so that means, like opioids, it produces effects such as euphoria or respiratory depression at low to moderate doses. With buprenorphine, however, these effects are weaker than full opioid agonists, such as heroin and methadone. Also, because of buprenorphine's long-acting agent, many patients may not have to take it every day. Side effects are similar to those of opioids: nausea, vomiting, constipation, muscle aches and cramps, cravings, inability to sleep, distress and inability, irritability, fever, and it can be misused, particularly by people who do not have an opioid dependency. In Suboxone, naloxone is added to the buprenorphine to decrease the likelihood of diversion and misuse of the combination drug product. When buprenorphine and naloxone is taken as a sublingual tablet, the opioid effects dominate and mitigates opioid withdrawals. If the sublingual tablets are crushed and injected, the naloxone effect dominates, and it can block the euphoric effect and potentially bring on opioid withdrawal symptoms. People should use precautions when taking buprenorphine by not using illegal drugs, alcohol, or sedatives, tranquilizers, or any other drug that can slow breathing, as mixing large amounts of other medications with buprenorphine can lead to overdose or death. It may be prescribed to women who are pregnant and have an opioid use disorder. Buprenorphine and methadone are considered the treatments of choice for opioid use disorder in pregnant and breastfeeding women. But in the U.S., methadone remains the current standard of care for the use of medication-assisted treatment with pregnant women who have opioid dependency. So buprenorphine treatment happens in 3 phases. There's an induction phase, which is the medically monitored startup of treatment performed in the physician's office or a certified outpatient treatment using approved products. And the medication is administered when the person has abstained from using opioids for 12 to 24 hours and is in the early stages of opioid withdrawal. It's important to note that buprenorphine can bring on acute withdrawal for patients who are not in the early stages of withdrawal and who have other opioids in their bloodstream. The second phase is the stabilization phase, and it begins after a patient has discontinued or greatly reduced their misuse of the problem drug, no longer has cravings, and experiences few, if any, side effects. The buprenorphine dose may need to be adjusted during this phase. Because of the long-acting agent of buprenorphine, once patients have been stabilized, they can sometimes switch to an alternate day dosing instead of dosing every day. The third stage is the maintenance stage, and it occurs when a patient is doing well on a steady dose of buprenorphine. The length of time of the maintenance phase is tailored to each patient and could be indefinite. People can engage in further treatment with or without medication to prevent a possible relapse. Patients can possibly switch from methadone to buprenorphine treatment, but because the 2 medications are so different, patients may not always be satisfied with the results. A number of factors affect whether buprenorphine is a good choice for someone who is currently receiving methadone. Patients receiving buprenorphine can possibly be switched to methadone. The last medication-assisted treatment we're going to talk about is Probuphine, and this is an implant for the treatment of opioid addiction. It is buprenorphine, and it's a subdermal implant. It's the first and only product on the market for maintenance treatment of opioid addiction that provides a non-fluctuating blood level of buprenorphine around the clock for a period of 6 months following a single treatment procedure. And these 4 implants are placed just below the skin. It's effective as a maintenance treatment for opioid dependence, and it provides some safety in that it's a subdermal implant, so it removes the opportunity for theft or child overdose or being diverted for illicit use. It provides continuous delivery of buprenorphine for up to 6 months, and then the insertion and removal procedure is performed in an outpatient setting. So some benefits: lower risk of diversion, it's additional option for MATs. It may be good for frequent travelers since there's no need for daily administration, making for fewer office visits. Patients are expected to begin treatment with oral buprenorphine to determine their dosage before physicians decide if a Probuphine is the right treatment. I'm going to talk for a minute about Narcan or naloxone. And naloxone is what we use to potentially reverse or prevent a life-threatening overdose. Naloxone is an opioid agonist, which means that it blocks the activity of opioids at the receptor sites, and an injection may be administered in a medical emergency to those who are experiencing an opioid overdose. It's also available mostly through a nasal spray for use in the community. And as a potentially life-saving intervention, both opioid users and family members should understand how naloxone works and how to use it in the event of an overdose. We do provide quite a bit of Narcan training here at the Ulster Prevention Council. We will be providing more training to family services staff, or you can contact us to receive some training and find out where other training is in your area. We're also encouraging human service providers to become a trainer so that you can provide it to your own clients and consumers. There's a new copay discount program at the pharmacy to obtain this. However, it may come at a cost. I found with my own health insurance that it was a fairly hefty sum to get it at the pharmacy, but there are many ways to obtain it throughout the community. When we're dispensing Narcan in the community at this point, a good practice is also to dispense fentanyl test strips so that people can test their heroin and see whether or not there's fentanyl in it. That's a good practice for mitigating the risk of overdose. And I just want to provide a reminder about proper medication disposal. Here in Ulster County, we have 19 drop boxes in law enforcement stations. Every law enforcement location in Ulster County has one of these boxes where you can just drop in medications without any questions. They aren't searched because of HIPAA. They're just boxed up and eventually taken to be incinerated, along with other evidence that law enforcement has. Some people are reluctant to go into law enforcement, so we are providing some other options. And one is, here, old meds won't disappear by magic. So cleaning out the medicine cabinet is very important. Counting meds, knowing how much you have on hand, locking it up, and getting rid of it when you're able to do that. But we also now have this new option of drug disposal packets. There are several different brands of these. DisposeRx is one of them. These are available for free at CVS, Walgreens, and Walmart pharmacies, and they are also available in the community. And this just gets poured into the pill bottle, and water is added, you shake it up, and it's completely neutralizes the drugs, and it can be safely tossed into the trash. We also have doTERRA bags, which is another brand that can be used to dispose of liquids and patches as well as pills. So it's very important to clean out those cabinets and get these things out of the way of a youngster or someone who might be looking to abuse a substance. It's a very important reminder. And here's my contact information, C. DePaolo at familyservicesny.org. Feel free to drop me an email if you are interested in this topic or other topics, want to hear more about Narcan training or drug disposal systems. Certainly get in touch with me. And we'll see you again soon for another part of the webinar series, Educational Expedition. Thanks so much.